All right. Good morning, folks. Thank you all so much for tuning in. For anyone who is tuning in right now, my name is Alex. I'm an educator with the Washington Poison Center. And we are halfway through our National Poison Prevention Week. So you may have joined us yesterday. My colleague Megan, who's in on this call now, but she's behind the scenes, kind of Oz behind the curtain today. She interviewed our new interim medical director, Dr. Scott Phillips. Now today I have the distinct pleasure of interviewing and introducing two of our wonderful pharmacists and C-Spies. When we say C-Spy, we mean Certified Specialist in Poison Information. So I'm joined today by Amanda and Curtis. So I'm going to ask a few questions and we'll dive right in. But first, how you both doing? Amanda, how's your day been so far?
Doing well, thanks, Alex.
Good. How about you, Curtis?
I'm good. Same day as yesterday.
All right, good deal. Thank you both so much for carving time out of your busy schedules to join us today. So I'll start with with an easy question. We'll start with you, Amanda. How did you get started with the Washington Poison Center?
Sure, I've been with Washington Poison Center since 2007. A colleague mentioned that there was an opening. I had previously worked at one of the busiest outpatient hospital pharmacies, and I thought that this would be a good opportunity to look into. And I've been here ever since, found it to be a really good fit. So that's how I got started here and have learned a tremendous amount about toxicology that just isn't necessarily a part of your standard curriculum or standard practice as a pharmacist. So it's been a huge eye-opening and career enhancing type of place to practice.
Wonderful. Before I move to you, Curtis, Amanda, for those who have never heard of toxicology before, what is that? What is that the study of or field of?
Sure. Yeah, toxicology roughly, it's a broad category and it's kind of a catch-all as well, having to do with poisonings and not just in the traditional mystery novel arsenic poisoning kinds of situation, but people or workers or families exposed to environmental toxins or medication misadventures, or just our largest bucket of work, which are children who are curious and doing their normal childhood exploring and happen to come in contact with things that may not be the safest for them. And so we definitely specialize in those types of exposures and how to manage them.
Excellent. Thank you. I'm glad you emphasized that poisoning is so much more than what you might think of in the traditional sense, and that mystery novel format that you said. Thank you. So Curtis, how about you? How did you get started with the Poison Center?
Well, my first experience that I can recall was I did a rotation while I was at pharmacy school. So it was in my final year. It's an educational clinical rotations that we do. I spent a month at the Poison Center. That was going on 30 years ago. Very somewhat of a different place then, but it really fit in well with my interests in terms of medicinal plants and my interest in adverse effects. So when I got out of pharmacy school, became a pharmacist, that it was just natural for me to want to do this sort of thing, and that's where I've been ever since. So
wonderful.
A lifer.
Awesome. That's great. Thank you for sharing that. Now, I should have said this right at the beginning of the stream for anyone who's watching, but you all, whether you're watching through YouTube, whether you're watching through Facebook, if you type something in the comment section, we should be able to see it. So if you have a question for me, but more importantly, if you have a question for Amanda or Curtis, feel free to write that in there. Now, this is titled A Year in Review, and so we've been kind of, the whole point of this particular stream is not just to get to know Amanda and Curtis, which is amazing and wonderful, but also to get their take on what's been so different with this last year, the hallmark being COVID-19. So again, starting with you, Amanda, what has been different versus the same about your work from March of last year to now?
I think that, well, a couple of big things. Of course, the pandemic has affected so many layers of everyone's lives. We're very fortunate at the Poison Center to be able to have pivoted to work remotely. And so, just in terms of just my own personal work life, being able to work from home has definitely created more safety, as well as being able to just be more focused on, not having to worry about, all the things folks have to worry about isolating. We were able to stay isolated pretty well and continue to do our jobs seamlessly. But from a standpoint of speaking with people who call in, I think that our callers, I know I mentioned families before, and that again is our biggest category of work, although we do help a lot with healthcare facilities. And for parents, nobody calls the Poison Center in a perfect moment. There's usually something's happened and it's not good. And so parents generally have always called in with a little bit of worry and concern, of course, about their children. But I think with the pandemic and everything parents have had to also pivot to do, whether they're working from home or having job loss and now having to care for children at home who can't go to school or aren't able to go to school, it's just added, I think, several layers of stress and tension. And so being able to quickly resolve at least this one little part of their day that we can help receive with compassion and concern, and talk through and help to also reassure and educate, as well as, if something does seem to be problematic, make a plan for next steps. And I think that being able to really hold space for people's, stress level has always been a key part of our jobs. But I think now with the pandemic, it's been even more so. And then as far as our healthcare facility partners, the amount of exposures we've had have really seemed to increase. I think there's a lot of despair and despondency and depression and anxiety that naturally people are experiencing when their lives have kind of been experienced so much change so quickly. And so being able to quickly and effectively help come up with treatment plans for individuals who, need that, next level of intensive care to help get them through an acute exposure has also been a little more intense, to be honest.
Yeah. Thank you for walking us through that. And a lot of the points you made there, I'm really glad you brought up that the Poison Center. One of our main functions has always been to shift some of the surge and the burden on emergency facilities. And if we can keep someone at home without having to go to the ER, then that's absolutely what we want to do. And that is even more crucial this past year because of COVID exposure and what you just said about being able to relieve just even a bit of stress when we're all kind of swimming in this sea of stress we may not be used to as much, I think is really huge. So Curtis, I'll hit you with the same question. What has felt different versus similar about your work in this past year from last March to now?
Well, I think much has remained the same. We always had the capacity to work remotely, so yeah, that was a very seamless move. But I think that the context is very different now. That we see things in a different light. So while the calls have remained the same by and large, I think we look at them somewhat differently. We do get questions about related to the pandemic. Is it safe to go to a hospital? And hospitals are under a lot of stress in terms of staffing and beds availability, and I think that my sense is that they're relying on us a lot more to help. I think there's a lot more sense of shared responsibility, uh, that I sense out of this, and I think that's a good thing. I think that we're looking more as the world and where we work in it as a team. It's a team effort. Um, so I think that's a good thing. It's hard to quantify that, but that's just my sense of it. But yeah, the calls have remained relatively similar to the way they've always been, but my perception of them maybe has changed.
Wonderful. Thank you for sharing that. And for anyone who's tuning in now, in case you didn't realize this, in addition to taking calls from anyone at home, at work, at school, the Poison Center does receive quite a few calls from healthcare facilities directly for consultations as well. So let's see. I'll start with you on this one, Curtis. We've got a lot of data we've been sharing with the public in some of our snapshots online, and we can see some of these larger trends. What are some of the trends that you're aware of that are of particular concern to you, most notably over this last year, Curtis?
Well, I do look at the data and have particular interest in certain areas. I mean, I've seen, and I don't know if it's a trend. Maybe it's my perception of it, but I've seen a lot of very severe, massive overdoses last year, and I hope that if that's a trend, I hope it doesn't continue. But it was very, very concerning to me in the context of the pandemic that we're not only dealing with a lot of stress to our healthcare system, but then to have a massive overdose, at the same time. Now, I think that we're fully capable of handling that still, but just the context of being in a pandemic, that somebody would be at that point in their life to really take an extreme measure to end their life. That's really concerning to me. I think of these difficult times as a time to come together, to have more closeness, and to realize that there are people that are there that they're so isolated, maybe, and at a point in their life where they would do something so terrible. But I've seen a lot of that. I don't know really if it's more than it was, but maybe I just have more empathy with that sort of case now. And so, yeah, I think that's one of the most concerning things that I've seen.
All right, thank you for sharing that, Curtis. How about you, Amanda? What are some of the trends that you've been particularly concerned about or paid more attention to?
Sure. Curtis is absolutely right. I think the intensity level of a lot of our overdose calls, which have always been a large part of our work, have definitely increased. Speaking to home calls, where we get calls, or from just regular folks going about their day, there's been a lot more, I think, creative exposures to cleaning products and disinfectants. Makes sense, because we're all, I think, much more keen to keep our environments clean and safe. But yeah, just having folks kind of, using bleach as a hand wash, or, more hand sanitizer. We've always gotten plenty of hand sanitizer calls, but I think people are more concerned about it now because they're paying attention more. And so, and then, I've recently, for whatever reason, I've gotten a lot of calls where people have mixed cleaners and generated toxic gases because they didn't understand one shouldn't mix bleach with toilet bowl cleaner. And so I think people are doing more cleaning and are, just as a result, we're getting more calls along those lines, as well as, coping with some of the misinformation that gets spread around. I do have had folks end up in an ER because a friend said this would be a good cleanse, or, I read this on this social media, and, a lot of times those end up not in an ER. They just kind of might ruin your afternoon or have a little discomfort. But there are some recommendations, whether it's being said wrong or understood wrong, have led to people getting into some sticky situations. We can fix them, but this is usually the good news. They don't tend to be permanent outcomes, but it's unfortunate that there are more of those misadventures, I think, going just because, people meaning to do the right thing and yet not necessarily knowing the best practice on how to use something.
Thank you for saying that. That is an excellent transition into a safety tip I'll share with everyone. At the Poison Center, we very much advocate follow the labels, follow the instructions. Don't mix cleaners, especially if it says don't mix this with another cleaner, ammonia and bleach being a common example. But that applies to so much more than just cleaners, right? That applies to over-the-counters, medications. That applies to prescribed medications and prescriptions. To only go with the amount prescribed. Only take it if it's prescribed to you, and that kind of thing. All right, so I'm going to shift gears a little bit. There has been, over the last year, so much discussion and rhetoric about the new normal, this mysterious concept of the new normal. And whatever that is, whenever that comes to be, for both of you, and I'll start with you again, Curtis, what do you hope will either remain or become a part of this new normal, whether that's larger trends, whether that's, kind of the experience you have working at home more, like whatever it might be?
The new normal. I think there's probably going to be a new normal here. And I think one thing that I miss is actually having, human face-to-face in the same room interaction. There's a lot of advantages to working remotely. I think there's potentially some improved productivity. We're spending less time on the road in a commute and more time, doing things that we, involve our work. But I think that, I'm not sure I would like to see a trend of less person-to-person interaction. But I do like the better chance of being involved in additional projects, whether they are remote or not. I do like having more time with my family. There's been a blurring of the lines, I think, between work and home, to say the least. Not just for me, but for my children, and I don't think that's a bad thing. Maybe that's a good thing. So maybe that's a thing that we should see more of. That maybe our work shouldn't be so distinct from our home. Maybe that's actually a good thing. We think of it as kind of a negative, but maybe that's something we should have more of.
Thank you, Curtis. How about you, Amanda? What do you hope to be a part of the new normal?
Sure. I mean, like Curtis, I too miss working in the call center. We have an office where we work together in person, and there's just a lot of collaboration that can occur just kind of off the cuff, much simpler. We have the capability to do this on instant message, but there's definitely a different flow when you're in person with other people, and just from a social aspect, just feeling like you're still in touch with your coworkers and what's happening in their lives. As far as with the public that we serve, I think the pandemic has definitely piqued people's curiosity, to say the least, to learn a lot more about epidemiology, which is the study of, how diseases spread, and learning about vaccines and learning about, disinfection, all of these things that we all had kind of this crash course in having to immediately, and there's been so much conflicting information, and just recognizing that as we're learning as we go, and what may have been standard practice in March 2020, we may now have learned, oh wait, this is something new. So approaching these types of challenges as we go forward with openness and curiosity is really important, because it's easy to say, oh, well, they're doing it wrong in this other state, or we're doing it wrong here. And it's like, well, I don't think we can really say right or wrong. We can say, based on what we know, this seems to be the next logical step. So just hanging in there as a community. And the Poison Center, I mean, we are able to, help people understand. And at the same time, the things I was saying last March are different than what I'm saying now. And that's because we're learning. We're learning more, and there's so many good people doing so much research and investigation. And it really is, a global team effort. And I hope that type of, as sticky as it's been sometimes over the past year, I think that going through those exercises, we're going to get to a point where we understand so much more and have much safer society as a result.
Wonderful. I think those are really excellent points that, this applies to everyone and every organization, but the Poison Center in particular. We have to be flexible and adaptable in order to adjust to this very rapidly, constantly changing environment. Not just with things like COVID, but there are new trends and new products and new ways that things can go wrong all the time. And so I think that those are excellent points to kind of hold on to into this new norm, whatever it is. All right, so we're heading toward the end here. I've got one final question for both of you. I'm not seeing any comments or questions in the chat box, which is totally fine. No problem. And if you happen to throw in a comment or a question after the stream ends, that is okay. We check those pretty regularly, and we'll follow up with you. So Curtis, I'll start with you. Any final messages you'd like to convey to the listeners, just as the pandemic continues?
Well, I was thinking about this. What final messages? I just, I have to come at it on a personal level. That what I think I have since the pandemic, what's changed me a lot is I have a lot more, I think, empathy and a shared sense of purpose. I think this sort of event should bring people together, and I would hope that everyone can see how fragile our place is in the universe, and that it is not a given, and that we should really really focus on one each day, and to slow down a little bit and take the time to see where we're at and the people that are around us, and to see how we can make everybody's lives a little better. So I think that would be kind of my final takeaway on that.
I like it. You managed to get personal and existential all at once. That was great. Thanks, Curtis. Now, Amanda, same question for you. Final messages you'd like to convey to listeners as the pandemic continues?
Sure. I'm going to be a lot more concrete and practical. Call the Washington Poison Center, the national toll-free number, 1-800-222-1222. We are here 24/7, 365. That's all day, all night, all year long. Nurses, pharmacists, we're here for you. And, even if it's just, I get a lot of folks saying, oh, this might be such a dumb question, and I'm thinking, look, if you're worried about it and I can give you a peace of mind, then it is absolutely worth the call. Peace of mind these days can sometimes feel in short supply. And if it's just as simply, it doesn't have to even be an exposure. It can be, how do I keep my toddler from climbing up inside of the fridge? I mean, just whatever you need. We're here to try and help sort those things out, help support families, individuals, healthcare facilities, to just try to take one or two things off your worry list. We are more than happy to do that. And it's one of the main reasons why I love my job and continue to be here and do this work is just the ability to really take a situation that when someone calls, their heart is racing, they're feeling short of breath, and it's not even them that got exposed to the thing, but just those worries about your loved ones. And, we can help you through that. You're not alone. We're here for you.
Wonderful. That was an excellent way to wrap things up by bringing up the Poison Center number there. And if you hadn't, I was about to. So thanks for setting that up. And for any who don't know this already, we also have access to interpretation services. So if English is not your preferred language, not a problem. The call takers can absolutely connect an interpreter to that call. And we're also confidential, so those same laws that protect your privacy in a doctor's office, they apply to us as well. And so big action item, big homework for everyone watching this stream, live or recorded, is to record that Poison Center number. However you'll remember it. Put it in your phone, tattoo it on your arm, whatever it is you need, so that that is, I mean, you don't have to tattoo it on your arm. Just so that you have it if you ever need it. And there's never any shame in calling the Poison Center. They've heard weirder stories, I'm sure. Emphatic agreement there. Well, all right, folks. I'm not seeing any questions or comments. Totally fine. Hit us up after the stream ends. Hope you all have a wonderful and safe day. Thank you for joining us.
Thanks, Alex.
Bye, everyone. Thank you, Amanda and Curtis, for joining.